Hi everyone, my name is Betty Scipio and my project is on improper medical records, billing and coding, documentation and maintenance. Improper medical records and billing and coding, documentation and maintenance is when the correct information is not documented and assigned the correct billing code. For example, if a surgery is done but it's documented as an office visit, that's improper documentation, and the code that would be placed on it would be improper also for the billing purposes. Some legal considerations are state and federal laws, such as HIPAA. For the license, each healthcare personnel that deals with medical records and billing and coding, especially, has to be certified by the AIHMA, which is the American Information Health Management Association, and also the AAPC. These are regulated by the Department of Health and Human Services and also the Office of the Inspector General. There are 5 ethical considerations of billing and coding. The first one is confidentiality. This is where all patients' information must be protected from the eyes of unauthorized individuals. The second one is neutrality. This is where preference for any or patient or insurance company should not hinder you from providing the care that the patient needed. So staying neutral is always a plus. The third one is honesty. As a biller, you are trusted with medical information, collecting of money, reliability, and customer relations. The fourth one is patients' rights. All patients must be treated with dignity, because many patients are in their most vulnerable states when they are seen in the medical facilities. So all patients have the right to privacy. And the fifth one is professional integrity. Professionalism is very crucial when interacting with patients, insurance company coworkers, basically vendors as on a whole also. Billers are a part of a team, so everything you do directly reflects on the team. Here is a little tidbit of what I picked up on ethical consideration. Principles of medical ethics, also known as a code of ethics, was established by the Medical Association in 1980. And this is where um, we're not really bound by law to follow the code of ethics set forth by it, but it's a good idea to use them as a general rule of thumb. As it pertains to liability and risk, extensive training is needed for this prevention, because coders don't normally worry about liability and risk. So that's the reason for extensive training. Also, choosing reputable companies, meaning that you would choose consultants and coding companies that know how to manage the risk in case it arises. The management practices that would be taken into consideration is employees will be monitored and held accountable by doing regular audits which will be conducted by the compliance auditing department or the health information manager, who will then in turn hold those employees that are improperly documenting medical records and billing and coding information accountable for what they do. As it pertains to patient-centered care, there are 4 patient access that can be a solution to the problem of billing. The first one is patient frustration with the billing system. The second one is only a few patients receive information about billing issue prior to service. The third one is emergency department encounters. And the fourth one is only a few patients are informed or prepared for the numerous bills they receive. This could be solved by the patient access employee, who can play a role of the patient advocate to ease the patient's anxiety and confusion about billing and prepare them for what to expect.